Good morning. It's nice to be here again, and I'd like to thank the trustees for inviting me here. There was a question from the top there from the chap who was in his 40s who had asked whether frequent, I think the word you wanted to use was ejaculation, frequent ejaculation prevented prostate cancer. And I had a discussion with Nada afterwards, and I said there was some evidence that frequent ejaculation does actually reduce the risk of prostate cancer. And that must mean that most of my patients are not wankers. So I just want to clear that up. But it's funny, you know, when you have these types of topics, humor does help. But it's interesting, Nada rang me yesterday at about 10 in the morning, or 11 I think it was, and he said I sounded sleepy. I was actually trying to have a day off, and there were multiple phone calls, and his was one of them. And he said, I know what you've done. You've dropped the kids at school, you're having a nookie with the missus, and I've just interrupted you. And I said, no, Nada, I'm just going through my slides for tomorrow, and I fell asleep. So, but then overnight I was obviously thinking about this talk. You know, you turn up here and you try and look as calm as you can, but actually you're quite nervous because you're in front of a whole bunch of people. And I had this funny dream, and I was in a bicycle race. And everyone was decked out with their fancy gear and their fancy bikes, and I had this rotten bike. And I crashed into something. I don't know what I crashed into, but I must have been thinking about Mike, because Mike's all into the fitness. But then I must have woken up and I felt a tickle down below, and I must have been thinking about Rosie King at that time. but what I realized was, in fact, my bladder was full. But luckily I hadn't wet the bed. If I could have my first slide, please. So what I've got to talk about is female bladder issues. And some of the things I'm going to discuss will be relevant to men as well. But mainly we want to focus on some of these female issues. As was mentioned before, these are the organs that we deal with in urology. Just a schematic there of a kidney on either side, which filters blood and then produces urine, which runs down those little tubes into the bladder where we store the urine, and then we expel it when we urinate. And obviously with women, we have some slightly different organs there. We've got ovaries on either side and a uterus, and most importantly, no prostate gland as such. Now, Nada did allude to some of these things, these lower urinary tract symptoms. So when you come to see one of us or see your GP and you're discussing these issues, these are the sort of issues we want to run through with you. And basically, it's not that complicated. It's that cycle of having finished passing urine some time earlier. The bladder slowly fills, so you get that feeling of wanting to urinate. And in some people, I'll discuss some of those issues today, where that feeling can become terribly urgent and unnecessarily frequent. And slow and variable stream is more common with men with prostate problems, but some women also get that, and that could be due to some abnormality within the system. Same with dribbling. We often think of men with prostates and slow streams, as Nada showed you on that graph, but women get it too. But these are basically the cycle of voiding. And I've added bleeding, even though that's not a typical symptom when we think of lower urinary tract function. But sometimes some of you with a condition in the bladder or the kidneys may pass blood, and that can be quite alarming, and that's something you would not ignore. I put this picture up because, as you do when you prepare for talks and you look for pictures, and I discovered a shiwi. And a shiwi is something that a woman carries in a handbag and allows her to pee in a public toilet. It's quite a novel little thing. I've never seen that before. And obviously that was picked up on Top Gear at one point as well. I don't know what the discussion was there and what it had to do with cars, but there it turned up in Top Gear. Let's look at the bladder again. So remember the little kidneys at the top, they produce urine, we store it in the bladder. Our sphincter muscle, which is that muscle that's a ring muscle that stays tight and stops us wetting ourselves, is closed, the bladder fills, and then when we want to pass water, the bladder contracts, that muscle relaxes sideways, and the water runs out, and we can empty the bladder, and that's the way it should be working. However, there are a few little things that can bother us. One of them is an overactive bladder, and all of us have suffered with an overactive bladder at some point. I'm currently suffering with that right now, which is that I would have urgency, hopefully not urgent incontinence, which is where I leak, but urgency when it gets really strong, that desire to want to pass your urine gets so strong that you are unable to suppress it. So if I had a strong urge right now and I could not suppress it, I'd have to leave the stage and try to void. Now, if I ran a small business and I was a mum and dad type business and I had to run the shop, well, I couldn't keep leaving every once in a while. If I had manned the front desk, I couldn't do that. If I was a surgeon, as I am, operating sometimes for hours on my feet, I can't be running to the loo all the time. So it does affect us because we can't suppress the urge and we leak. It becomes a significant issue. Daytime frequency, this is when we're passing our water just a little bit too often. Every hour, every second hour, it's getting to be a little bit of a joke, and we're starting to void too often at night. So we're now not sleeping properly either. So what we tend to do is we ask about that frequent urge to void that can't make it to the toilet. So sometimes you get the urge, but you actually can make it, but just in time. And that gets a bit close for some people. And this can be a problem for many of our retirees who are traveling. You hop on a plane, and next thing there's turbulence, and you can't go to the loo. And it might sound funny, but it can be quite embarrassing. The leak can be very small, so you're just aware of something on your underpants, and that's just a bit annoying. Or it can be very large where it comes through the clothing. And that can then affect how you even dress. And once you get up at night too often, it just gets a bit tiring. If you look at incontinence, which is what the term we use where leakage occurs, and that can be on this left-hand side, stress incontinence. And stress incontinence is when we cough or sneeze or make a sudden positional movement and we leak, and women do suffer with that. That group's there. Urge incontinence is another group, and urge incontinence is what I've just been talking about, that strong urge that you can't suppress. And then urgency and frequency, which is going often but not quite leaking, but becoming bothersome. And of course, mixed groups. Overactive bladder is part of that whole symptom complex in some way.